Are you still there, doctor?
Yes, I can hear you.
Okay. All right. We'll get into this. I'll open us up here. So I think for starters, we'll welcome the viewers, Stanza, and welcome back to the OLCN 7 Generation podcast. My name is Fraser, and today we have a very important conversation for our nation, our families, and our schools. Joining us is Dr. Khan, the Regional Medical Health Officer with the First Nations Inuit Health Branch for Saskatchewan under Indigenous Services Canada. Dr. Khan has been a key leader in public health across First Nations communities, and we are honored to have him here today. We are also joined by our very own Director of Onion Lake Health, Mr. Albert Jimmy. Together, we're going to talk about questions many of our community members are asking right now. Is COVID still around? Why are so many people getting sick? What do we do when symptoms start? Are there any restrictions still in place? And who makes decisions around school closures when illness spreads? We'll also hear from Dr. Khan about the impacts we're seeing, not just here in Onion Lake, but in our schools across Saskatchewan and even globally. This is an important conversation for all of us. So, hi for tuning in. Let's get into it. So, I think for starters, Dr. Khan, for those who may not know you, can you briefly introduce your role and the work you do as Regional Medical Health Officer with Indigenous Services Canada?
Thank you so much, Fraser. Good afternoon, everybody who is with you in the office and who are listening. It's truly an honor to be with you. I was in the community recently, like maybe a couple of weeks ago, and we had a great conversation with the community members and leaders, program people on the importance of vaccination and what we are heading into. So before I say something on that, I work in public health. I'm a public health physician, and mostly in our work, day-to-day work, we look and hear and respond to communicable diseases like COVID, flu, influenza, tuberculosis, like all the common infection and illnesses across the community. So we respond to that. We make sure that people who have been diagnosed with these infections have the proper diagnosis, proper treatment. They have the right treatment. Their family and their communities are protected. So that's what we do in our day-to-day job.
Okay, right on. Thank you. Albert, can you share your role as Director of Onion Lake Health and how your department monitors and responds to health concerns in our community?
Yeah, thank you, Fraser. Well, my role is I oversee all the health programs in Onion Lake, and we have quite a number of programs. One of them is a community health, program, and we see we also have a clinic, where we have two full-time doctors that come to Onion Lake, and also nurse practitioners. But we have a challenge right now. We have only one nurse practitioner, and we're trying to recruit two more, which is a challenge. But anyway, and there's a lot of people that come into our clinic, asking for us, to see a doctor and all that. So it's really kind of over flooded right now. A lot of people being sick, and recently I got a call from our director of education. That was last Friday, asking me all these questions that you just raised, and the main question was, is COVID around? And yeah, I told them, and I can, ask Dr. Khan, to also assist on the response of these questions. So, but basically, we're not the only ones experiencing this, increase in sickness, flu or COVID or RSV, all these things. And COVID is around, but it's considered as an ordinary flu like we had years ago. That's how it's considered. So we need to be precautious and advise people if they have symptoms, to stay home. If they have children, with symptoms, they should keep them at home. And just like we did in the COVID era, with all the precautions. And we have a report that our immunization, status is really low. So we need to encourage the parents to bring, get their children immunized on, the flu shots, etc., and also the adults, because it's really hitting the young people and the elderly people. So that's all I have to say for now.
Hi. Dr. Khan, a common question we keep hearing in the community is COVID still around? Can you explain the current status of COVID-19 in Saskatchewan and in First Nations communities?
Of course. So, first of all, this year has been very, very significant in terms of communicable diseases. We had a lot of measles, pertussis circulating in the communities across Saskatchewan. And for both of these diseases, we have really great vaccine, which has a really long, 50-year safety record. For COVID, as we are in the winter months, we not only come together indoor, but a lot of people have COVID, influenza, rhinovirus, common cold, and many other respiratory infection viruses are circulating. The other compounding factor is, as Albert mentioned, that overall in Saskatchewan and in the community, very few people have received vaccination. So if you would recall in pandemic, we used to use the word community immunity or herd immunity. By that, I mean the more people are vaccinated for COVID, for measles, for pertussis, and some of these other vaccine-preventable infections, then then in the family or in the community, the disease don't spread. So if people have received vaccination, whether it's the COVID or influenza or others, it provides a lot of protection. It saves you from hospitalization, severe infection, and ultimately death. So a lot of people who are seeing coming to the ERs across Saskatchewan, especially young children and elderly people, because they have not received the vaccination, it makes them vulnerable. And when you come together in families, in parties, in different gatherings, the virus is spread very quickly because anything that is respiratory in nature, like COVID, spread through respiratory route, like coughing, sneezing. So when people are together and one of them is sick and people around them are unimmunized, then it's very easy to spread for the virus and the bacteria to spread. So the answer to your question is that yes, we are not only worried about COVID, but we are also worried about influenza, rhinovirus, common cold, RSV, which primarily impact young children and elderly people, especially people with immunocompromised systems, pregnant women, young children, if somebody has other comorbidities. And if you are living with a chronic disease in a crowded condition, then for the viruses and the bacteria spread very quickly and can lead to complication, including hospitalization. So the most important thing for this winter season is that for all these infections, really good vaccines are available. The nurses are ready. They can book your family. They can book yourself. And if you get this vaccine, you not only protect yourself, but your family and your community. And most of these infections have similar symptoms. So if you were to look at flu, COVID, RSV, they basically are respiratory in nature. By that, I mean people have fever, they're sneezing, there's sore throat, there is cough, and the symptoms are similar. So I think the most important thing is that if you are sick, we would like that you see a doctor and get tested. Unless you are tested, we would never know whether this is flu or COVID or RSV or something else. So it's really important that if you feel like this is an ordinary cough and symptoms, we suggest you wear a mask, stay home, don't go to work, call your nurse or a doctor, and our helpline like 811, and then they will guide you a little bit whether you should go see the doctor immediately. If the symptoms are severe in nature, you cannot breathe, you have a high grade fever which is not coming down, and a couple of days have passed, we would really like that you see a doctor. Sometimes people think, oh, this is flu, will go away. But if you have other underlying conditions and you are like a young babies around and elderly people around, it's really good to check that you can be protected. So I think the best defense, the best protection is the vaccine. So the community nurses are available. The vaccine is there plenty. In plenty, stocks are available. And you can just book yourself and protect yourself for this winter season.
Sounds good. Question for Albert. This in regards to what Dr. Khan was touching on there. What trends is your team seeing in Onion Lake regarding the flu, RSV, or other common illnesses?
Well, the only thing we know is there's quite a few people being sick in our community right now. And I had a report from the school, administration. Over 50% of the children are absent from school. That was this past week. That was the report I got last Friday. And they were asking me, what's the protocol to close the schools down? There's really no, restrictions now with COVID. It really lies with the administration and our leadership if they want to, close the school down. That's their call.
Dr. Khan, do you have anything you want to add to what Albert was speaking on?
Yes, I totally support what Albert said. That before I respond to this question, I want to take you back a little bit. 3 years ago, we had the pandemic. We had pandemic virus everywhere, like the COVID virus was everywhere. It was in the school, it was in the band office, it was in the community. Anywhere you go, the COVID virus were around. And even in that situation where it was an international emergency, we did not recommend that school should be closed or any business should be closed, because people had enough of disruption in their lives and disruption in their education, and especially for young children and adults, they lost so much of education time. So we do not recommend closing schools, although we do see that COVID and flu and all these things are around. But the way some of the tools that are available is really good to protect you and your family, whether you are in the school or workplace or a business, because you have access to really good vaccines. You have access to good, medication and diagnosis. So I think you think of a school closure or closing any business or facility when you don't have all these things. So the fact that we have now a good vaccine, testing is available, people know really well how to stop the spread of the disease, which is stay home if you're sick, wear a mask, go see a doctor, and if the doctor wants, they can put you on antiviral, and they can do whatever that extra intervention is needed. They will do that. So with that, there is absolutely no need to close the schools unless it is a new virus, a new bacteria that we don't know about, and we don't have any of these testing, and we don't have any of vaccines, and we don't have any treatment. Then certainly we would like to stop the spread of that disease in any facility. So my advice to Pam, who is the nurse manager, and Albert, that you can certainly talk to us if you see more than the usual illness.
Mm-hmm.
But in the pandemic, we said that if a school has more than 10% school kids sick or absent, that's a trigger to check things like whether these kids are off because of illness or because something else is happening. And of course, we would like that these kids are tested so that we know what it is. So now that we have so much technology and so many better tools in our hands, it's really good and recommended that schools are not closed unless it's really, really the last resort to do. So we will always work with Albert and his team. If there is any situation that people are concerned, parents are concerned, teachers are concerned, here in this winter season, we are recommending that all the teachers in the school, education directors, the bus staff, the drivers, the school kids, parents, everybody should get the vaccine. And once you have the vaccine, you have really good immunity, and it protects you from severe episode of flu. It protects you from hospitalization, and it protects you from complications.
Thank you. I think a lot of people are still unsure. Are there any restrictions or isolation requirements if someone tests positive for COVID today?
So, if you would recall, as the pandemic was declared, because it was a new virus, we didn't know how this virus would impact the human population. We didn't know, we didn't have the vaccine, we didn't know what drugs would work against it. So in that scenario, a lot of restrictions, these isolation measures were in place because we didn't know anything about this virus in the beginning. Now that we know so much about this virus, and we do know that this virus keeps changing, but also the vaccine to protect against it is also changing. So I think with the good vaccine, good diagnosis, and a lot of good preventive tips and advice, I think people can protect themselves, and there would be no need of imposing restrictions on people. And you would recall that the restrictions were very deadly to businesses and peoples and families. And I think in the current time, restrictions are not required. But my advice is that people who have symptoms and are sick, they should stay home. So if a teacher is sick, they should stay home. If a parent is sick, shouldn't go to work. If a child is sick, they shouldn't go to school. With those type of measures, you wouldn't need to impose any restrictions on people. And basically, people are supposed to be staying home unless your symptoms are gone. So if your symptoms are gone, you feel healthy, you feel energetic, you feel okay, then that is a sign you can go to school, you can go to work. So the body will tell you. So I think with good testing, education, some of these wearing a mask, like, it's winter and a lot of people are coming together indoors. So I think that is a risk. So I think if people have underlying conditions, like you have a kidney problem or a heart problem, or lungs problem or any other underlying like diabetes, I think it's a good idea to wear a mask, avoid large indoor gatherings, and just restrict yourself to home. And once you feel better, you can come out.
Thank you. Albert, do you want to add anything to that?
I just want to maybe ask Dr. Khan. I know I went for my flu shot, and I also got the COVID shot. I had 2 needles. I think maybe people are kind of confused. Maybe just the flu shot is sufficient. I think they should be asking for the COVID, vaccine too at the same time. But
Yes,
I'm not aware if everybody needs that or is it
yes,
just the elderly?
yes. No, everybody needs that. Anybody above 6 months old can go for it. All vaccine can be given on the same day. It does not interfere with your immune system unless you have acute fever or coughing. I would then suggest that you can just wait for a day or two till you feel better. But other than that, anyone can go and can get their vaccine on the same day. And not only COVID and flu vaccine, but you can get other vaccines too. Because these two viruses are different, the flu virus is different than the influenza virus. The influenza virus is different than the rhinovirus and measles virus. That's why there is different vaccine for some of these different viruses. So it's really important that people understand that one cannot protect you against others.
Thank you.
Thank you. I have another question here, Dr. Khan. How do global patterns in respiratory illness and COVID waves affect remote First Nations communities, such as Onion Lake?
Yes. So you are on the border with Saskatchewan and Alberta. So there is a traffic from both sides. So I think it's a good thing for businesses, but I think it also puts the community and the influx of different people that can bring the infection. So I remember when we declared the pandemic in Canada, I think our first case was in Onion Lake. And in that time, I think the community was doing everything possible. Everything was in place, all restrictions were in place, all information were shared with people. But I think the influx of people going back and forth between urban and rural, between different countries. So imagine the number of flights from China coming to one Canadian airport is it's incredibly alarming. So global travel is certainly, there are good things about global travel, but I think there are some risks that you can bring. So measles actually in Canada was imported. So came from outside. So was the COVID virus, came from China and, spread around the world. So I think there's a lot of travel people do, whether it's the global travel, but there is also a lot of interprovincial travel. And that's why, if you would recall, every community has a gate to get in or to get out. And they had security staff, like who's coming in, who is going out. I think those sort of things are not needed. But I think it's good to be vigilant if you are traveling internationally or somebody's coming from international travel. I think it's always advised that you watch yourself. If you have symptoms, just stay home and get tested. So I think there are some risks that we all live in currently. We live in a global village. Everybody is everywhere, anytime. So I think that actually brings the risk of transporting these viruses from one area to another.
Thank you. That's all the questions I have. I'm not sure if there's anything else you guys would like to touch on. If I missed anything, just any important announcements or messages for the community.
So I think the last thing that I would like to share with the community, the band members, that as Albert mentioned, his entire team is available Monday to Friday, and even on the weekend. And people in the school, the band office, the gas station, anybody who is concerned about their protection, the simple thing is that just call the nurse. I'm sure it's very easy to call the nurse in the community and book yourself and your family for the COVID, influenza vaccine. If you have children in the family, all those children should be up to date on their required immunization. So that way they will be protected against measles, pertussis, and many things. So I think for everybody, they can just book themselves and their families. And that's the only way you can protect yourself, your family, and the spread of any of these diseases in the community. That would be my advice for this winter season. And this is also a holiday season. So people will be congregating, people will be coming together, sharing things, which is a tradition, which is great. And we should be sharing stories and tradition, but not flu and COVID, influenza.
Yes, sir. So I think just to be clear, for clarity for the membership and the viewers, I think we're all aware that there is flu-like symptoms, RSV, in the schools going around right now. Nothing to be alarmed about. Just to be safe, take the precautionary safety measures in and around school. If you notice your kid is getting sick or coughing or fever or anything like that, keep them at home. I think the school is a common place for viruses to be floating around and things like that. So just to be cautious of things like that with our kids. Back to Albert. What final message would you like to share with the people of Onion Lake regarding respiratory illnesses, community health, and staying prepared?
I guess, just to echo Dr. His advice is to try and get everybody, get their vaccine and get their children, up to date with their immunization, etc. That's the only way I guess we can really be safe in the community, is to work together and encourage, one another to do that. And that's all I have to say. Yep.
Thank you.
Fraser, I have one more advice.
Yeah.
People can certainly call the Saskatchewan Health Authority online to www.forflu.ca anytime, or by calling 1-833-727-5829 Monday to Friday. Walk-in clinic locations are listed online. And also, you can read about it on the line and call Healthline if somebody has severe symptoms. And you can get to the ER. So I think calling Healthline is another. So there are a lot of ways for you to get the information to protect yourself and your family and the community. And I think the easiest thing is the community nurse that you can call and book yourself. And I think that is the best way to protect yourself in this winter season and holiday.
Sounds good. Thank you. Anything else, Albert?
No, thank you.
Very good. Okay. Hi to our guest today, Dr. Khan, for bringing clarity, knowledge, and perspective from the regional and national level. And to Director Albert Jimmy for sharing what's happening here at home in Onion Lake and how our health team is responding. Today's conversation reminded us that community health is everyone's responsibility, from staying home when we're sick to watching out for our elders to keeping our schools safe for our kids. The more informed we are, the stronger we are as a nation. Thank you to everyone listening to the OLCN 7th Generation podcast. Stay healthy, stay safe, and take care of one another. Hi, and we'll see you on the next episode.
Happy holidays, Happy New Year to everybody.
Thank you,
Same to
Doctor.
you.
Take care. Bye-bye.
Bye-bye.